My dear friends, here I am showing my wonderful experience in international conference that was organized in New Delhi on multiple sclerosis topic, a demyelinating disorder.
The PML that we are all very dreadfully afraid of. So what has been done is basically Biogen did was they started an anti-JCV serostatus or index before we start therapy. So typically when we start a patient on tisapri, we do a JCV index, and only if the index is negative or in an indeterminate ratio that we start the patient on tisapri. And every 6 months you need to do the JCV index. And you can do this safely till the end of about the end of 2 years. And it is given once in 4 weeks. So the main side effect, of course, as I said, was basically PML. I'm just coming to that only. So the PML risk mitigation strategies which has been developed is in 2006, what was found that the drug was very effective, but because of the PML risk, it was withdrawn from the market. And then came the JCV mitigation strategy. So you do a JCV index every 6 months in most of these patients, and after 2 years, you need to do this follow-up much more frequently. You need to do an MR every 6 months. And what has happened, it has been found that this drug also works well even given in 6 weeks. So one of the recent strategies is to do an extended interval dose. You give this drug not only at 4 weeks, but at 6 weeks of time. And I will show you some of the data from India also, which we have recently published. And what has been seen is that overall PML incidence over time has now kind of tapered off to about 4 patients per 1,000 patients. So over the last 7 years, the incidence of PML has leveled off. So because of this PML mitigation strategy, the use of JCV index and patient doctors being more careful, the risk has substantially gone down. So this was a study from India which we published with Thomas Matthews and our colleagues. And what we found was that natalizumab, fortunately till date, there has been no case of PML with natalizumab in India. And it's efficacious both in RRMS as well as some patients of SPMS. And so we are fortunate enough that because of the coming of the JCV index, we are not yet to see any PML with natalizumab in India.